Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Trigger finger is a pretty common condition. It's painful. It's the finger is catching in both directions. So when you try to bend it, it can catch, or when you try to straighten it out, it can lock. And it's pretty common. And there's kind of specific symptoms to it. For instance, you get this nodule at the bottom of the finger by the palm of the affected finger. So you get a bump there. And sometimes massaging that bump can really help, by the way. And the finger catches, it kind of locks when you bend it, and it can suddenly pop straight out again. So you get this clicking sensation when you move the finger. You could feel it clicking into place. And you get stiffness, especially, like I said, in the morning. Now, the name might evoke the thought of somebody pulling a trigger, a hunter pulling a trigger on a gun, but that's not actually what's happening. The name is when you get this trigger-like snap when your finger suddenly releases. So we're going to talk about trigger finger, who's more prone to get it, why would they get it, what's the typical treatment, and what would I recommend as an alternative, a viable alternative. So thanks for tuning in to the Invite Health podcast today. You can find all of our episodes for free anywhere that you listen to podcasts, or visit invitehealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And the information on this episode is linked at the episode description. Hi, my name is Jerry Hickey, by the way. I'm the Senior Scientific Officer over here at Invite Health. I'm also a nutritional pharmacist. I actually had trigger finger once, and I treated it very effectively, very quickly. So I'll discuss that later in the program. So let's get going. So trigger finger, it's also known as stenosing tenosynovitis. Stenosing tenosynovitis. I don't make up these words. Everybody in the healthcare industry gets stuck with these words. Now, it usually works in or affects mostly two fingers, the ring finger or the thumb. It can happen in any finger, but it's usually the ring finger or the thumb. It's pretty common. It occurs more frequently in women than men. Of course, not everybody is reporting that they have trigger finger. They might just go to a pharmacy and get some Advil and treat it that way, because that can be effective, but we'll discuss that later. It's more common in people in their 50s and early 60s. It's an issue because the tendons that bend the fingers, they stiffen, they're in pain. See, the tendons connect muscles to joints and bones. So the tendons in the finger, they go through a sheath. The sheath surrounds them. And trigger finger occurs when the tendon gets inflamed or the sheath gets inflamed and they're swelling, and there's not enough room for the tendon to glide smoothly through the sheath. So the tendon develops sort of a knot, or the sheath covering the tendon swells and narrows, so that prevents the tendon from gliding smoothly. So then the tendon catches, it could get stuck. You get that popping and clicking. You get the pain. It's a vicious cycle because the more often this happens, the more it swells and gets irritated, and the harder it is to treat. So I already went through some of the symptoms, but let me go through again. There's pain. There's kind of a slight thickening at the base of the affected finger or thumb. So like I said, it's usually the ring finger or the thumb. The snapping sensation can develop slowly over time, or it can happen out of the blue very quickly. So it can start suddenly. You might find it worse in the morning. You might wake up and you find that your thumb is locked or your finger is locked in place, and it gradually releases over the following hour after waking it up. Try massaging it. Try massaging it at the base of the finger. Now, if there's one nodule, an injection of a steroid into it usually helps most people. And they give it about 6 weeks before they generally give an injection. You know, they tell you to try Advil or Aleve. And then they give you an injection, and then they wait another 6 weeks to see if you need a second injection. But if there's multiple nodules, the injections don't work that well. So that's just kind of a rule of thumb right there. So aging may play a role in trigger finger, and we'll talk about that later with the treatment, because your tendons, just like your ligaments connect bones and joints, tendons connect muscles. Just like your tendons, your ligaments tend to dry out and stiffen with age, so it's easier to inflame them. So it might be part of the aging process. In women, it may become more common after menopause, so there may be some kind of effect of estrogen keeping the tendons healthy. Not sure about that. But you see it more frequently in diabetics. Listen, in diabetes, everything gets messed up. Everything starts to stiffen and decay. Because diabetes is not just a disease of sugar, it's like a metabolic disease. So you see it more often in diabetics, you see it more often in people with gout. Those are people with a lot of uric acid in their joints. It's like having shards of glass in your joints. And also people with rheumatoid arthritis. But, you know, it's repetitive movements. Like you might see it in guitarists, or people who play the piano, or people who do certain trades where they're always using certain fingers, or typists. And you might just get it from exercise, putting too much pressure on the ligament or tendon. So obviously, you're supposed to rest. To treat it, you're supposed to rest the finger that's affected. But that's not always doable. You know, if you're making a living playing the piano or something, you might not be able to rest that finger. Okay? But it's good if you can rest it. It's even good if you can immobilize it. Usually they immobilize it by, like if it's the ring finger, they'll tape 2 fingers together, or they'll put a splint on the fingers. But if you can't do it in the daytime, put a splint on it at night. It'll really help. Now, like anything where there's inflammation, you can apply ice. So you can apply an ice pack twice a day. The thing with ice, don't leave it on for more than 20 or 22 minutes, or then it becomes negative. So I generally tell people use an ice pack for 15 minutes. Doctors normally tell people to take over-the-counter non-steroidal anti-inflammatory drugs. In fact, I just did a couple of podcast episodes on non-steroidal anti-inflammatory drugs. The reason I'm doing this podcast episode is one of the people I work with, her father has a really bad case of trigger finger right now. So she wants her father to listen to this podcast episode. And I said, you know what? I've had it before. It's not uncommon. I get people all the time asking me about it. Let me do an episode on it. So non-steroidal anti-inflammatory drugs are drugs like aspirin, Advil, Aleve. And they have consequences. They can raise your blood pressure. They can trigger a heart attack or a stroke. They're not good for your eyes, your hearing, your kidneys. And some people, they trigger asthma attacks. We're prone to asthma. They can raise your blood pressure. They can make your legs swell. Not a good thing. They can even cause severe bleeding ulcers if you stay on them too long. And here's the issue. Generally, when you treat trigger finger, you stay on these drugs for a month. That's a long time, because the longer you stay on those drugs, the more dangerous they are. They're anti-inflammatory drugs that reduce pain. So we do have some true alternatives for that really work. Great deal of research behind them. Now, like I said, if it's not fixed within about 6 weeks, an orthopedic doctor might recommend giving a steroid injection into it, which really can help, by the way. And if the first injection doesn't help, they might recommend a second injection. But let's talk about some natural, really safe alternatives for helping with trigger finger. This could be useful with any type of tendonitis. In other words, it could be the Achilles tendon in the ankle. It could be golfer's elbow. It could be tennis elbow. I mean, those are the most common sites for tendonitis besides the fingers. So first of all, devil's claw. Devil's claw is a shrubby plant that grows in the Kalahari Desert. That's in southern Africa. It covers countries like Namibia and Angola and Botswana. And it's sand. So the plant grows really low, so it doesn't blow away. And it has these hook-like barbs that anchor it into the sand. That's where they get the term devil's claw. The real name is Harpagophytum procumbens. So if you went into a a botany textbook, it would be called Harpagophytum procumbens. And inside the plant, there's something called harpagicides. And these are really the magical ingredients that are great for inflammation. I use devil's claw frequently for people with arthritis. I use devil's claw frequently for people with neck pain or back pain or shoulder pain, their rotator cuff, and for people with tendonitis. So the harpagicides have been shown to be safe. So if you buy devil's claw, you want it to be standardized for harpagicides. And if you want to treat tendonitis, you need about 90 to 100 milligrams of the harpagicides daily and take it with food. Devil's claw is really safe. When Columbia University reviewed the research on it, they said, hey, devil's claw is safe. And other researchers like Aldermore Health and the University of Southampton in England, when they looked at it, they said, hey, it's great for pain. It's great for all kinds of pain. It really does work. It works as well as NSAIDs. NSAIDs would be drugs like Advil and Aleve. So devil's claw is one herb you can try, but get it standardized and take it with food so it doesn't upset your stomach, because it could slightly upset the stomach. A second ingredient that can help is Boswellia serrata. That's commonly called frankincense. Boswellia serrata has ingredients in it called acbuz, and they're very good for inflammation. They inhibit a pathway called the lipoxygenase pathway. It's an inflammatory pathway. The lipoxygenase pathway can inflame the joints in all types of arthritis, but that can also inflame the intestines, like in Crohn's disease or colitis or irritable bowel syndrome. It can inflame the skin in psoriasis and eczema. It can inflame the prostate and prostatitis. It's involved with interstitial cystitis inflammation, like the urinary tract, the bladder, and the kidneys. It's involved with severe menstrual pain. It's involved with cancer metastasis. It's also involved with lung inflammation and brain inflammation. So the Boswellia serrata can actually be, AKA, also known as frankincense, can be very helpful with these things. There's a lot of research on it from places like Georgetown University and Ohio State University, etc. Another herb that could be very useful is turmeric, but use the entire plant. Research has shown that the entire plant works better than just using its most significant ingredient, which is curcumin. Curcumin makes the turmeric plant. They usually use this big root called a rhizome to get these ingredients, this big fat root. Rhizome, that's the name. They often get just curcumin out of it. And curcumin is only about 3 to 5% of the entire plant. So it's not the whole story. There's over 100 ingredients in the turmeric plant that have significant impact on pain and inflammation. Many of them. Like it's not just curcumin, there's also bis-methoxycurcumin and aromatic turmerone plus other ingredients. So you really want the whole plant. When Baylor University researched curcumin, they actually used one of our curcumins called biocurcumin. They found that the whole plant works better than just the individual ingredients. You also, when you get a turmeric product, high in curcumin, because you do want the curcumin in there, it's a significant ingredient, you want to make sure it's well absorbed. So there's several well-absorbed curcumins. There's a very low dosage one that's involved with UCLA, where they're studying it for brain health, but I don't think it's probably going to help with arthritis. It's not potent enough. And then there's one where they add the black pepper fruit ingredient to it called bioperine. So it's called a curcumin complex or a curcumin blend. That one can help. It's usually 500 milligrams. A lot of you in clinical trials on it. Usually you take one twice a day with meals. And then there's the one I spoke about before called biocurcumin, which has many human clinical trials published in medical journals. They micronize it. They make it a much smaller particle size, and they make it more water soluble, so it's very easy to absorb it. So those are very good for inflammation. I use those all the time for muscle pain, musculoskeletal pain. Like I have a number of people who are older dance instructors, etc., and older professional dancers, and they wind up with backaches and morning stiffness and knee pain, etc. It's been perfect for them. People with rotator cuff problems, the shoulder, people with nerve pain, like sciatica. Your sciatic nerve comes out of parts of your spine, kind of like the middle lower spine, and it's the biggest, longest nerve in your body. And a lot of people have problems with their sciatic nerve. This could be helpful in that. The biocurcumin can be helpful with sciatica. Plantar fasciitis, that's another form of tendonitis. It's in the heel. But I commonly use a well-absorbed curcumin turmeric product for tendonitis. It's very helpful because it's a great anti-inflammatory, anti-pain ingredient. It works with the endocannabinoid system, a dominant system throughout the human body. So in the amygdala, that's a little thing in your brain, you learn chronic pain. Let me give you, for instance, you're not supposed to have chronic pain, okay? If you break your ankle, the pain is supposed to occur when you stand and try to walk because your body's warning you, don't move the ankle, you're going to make it worse, you're going to damage it more. But if that bone has healed and you have pain 6 weeks later, that's kind of like you learned that pain, it's become a habit, and that's usually taking place in a part of the brain called the amygdala. And curcumin, just like CBD, affects CB1 receptor sites, which can help with chronic pain by unlearning it in the amygdala, which is interesting because that's also where fear could take place. So it can help with fear, like irrational fear. And anxiety, it can help with anxiety. I'm not saying the anxiety takes place in the amygdala, but I'm saying the curcumin can help, the CBD can help too, by the way. Now, let's get back to it. Your tendons get more affected with age. So something like trigger finger, everybody I've dealt with trigger finger has been older. They've typically been in their 60s or 70s. The tendons, which connect your muscles to like your bones and joints or to other muscles, they kind of dry up and stiffen with age. And there's a reason for that. You're not making the peptides anymore in enough quantity to keep your tendons and your ligaments healthy. So they tend to dry up, they tend to stiffen. So if you have repetitive motion like golf or running, it's going to affect the tendons involved. So the same is true with trigger finger. So there's a product that was developed in Germany called Tendoforte. What they do, they take type 1 collagen and they break it down. They hydrolyze it with enzymes. They break down the bonds. And they release the peptides that is specific for ligaments and tendons, and they super concentrate it into a product called Tendoforte. A lot of research behind it. It's very good for your ligaments and tendons. So that's what I do when somebody has trigger finger. I tell them, you really have to try and rest it. You really have to try and immobilize it. Get on a really well-absorbed turmeric. Get on a really well-absorbed frankincense. You could get on a really well-absorbed devil's claw. Any of those will help. Any one of those three will help. And yes, you can mix 2 or 3 of those together if you want for even better improvement. And the other thing is that Tendoforte. The Tendoforte over time will rejuvenate your ligaments and tendons so you could keep on exercising or gardening or walking or running or playing tennis or pickleball or whatever you're doing. So that's what I recommend. And of course the ice packs. Now, thanks for tuning into the Invite Health podcast today. You can find all of our episodes for free wherever you listen, or visit invitehealth.com/podcast. Please subscribe and leave us a review if you can. You can also follow us on Twitter, Instagram, and Facebook, whatever that's called now. They changed the name, at Invite Health. See you next time in another episode of the Invite Health podcast, and thank you so much for listening. Have a great day. Jerry Hickey signing off.